My name is John Bartley. I'm the VP of People and HR Services for Turning the Corner. I've been doing HR work for 20 plus years now. I started in the nonprofit world at a large cancer research nonprofit in Seattle. And so I started with the gateway drug of recruiting, and that's what pulled me in. And then I started learning about all the different aspects of HR. And when I left there, I was managing a large team of people. But then I moved here to Colorado, and I started working for the state of Colorado. So I had experience in the public sector. Interestingly, while I was there, FAMLI, what I'm going to be talking about today, that voter initiative got passed. And I got to sit in on some of the conversations between business leaders, community members, and state representatives to try to figure out how they were going to put that in place. So I was kind of there for the early stages of it, just as a silent partner. So I just got to witness the conversations, arguments, debates that happened. So then I was at the state. When I left there, I was the deputy director of the Division of Human Resources, which is the mothership of HR for the state. I got to be in that seat in 2020 and to help the state figure out what we were going to do with COVID and how to respond to that. So that was a very interesting place to be. And then I moved over to Turning the Corner about 3.5 years ago. They were a vendor of mine while I was at the state, and that's when I got to know them. And I thought, in the back of my mind, I thought, if I ever leave the state, I'm going to go and talk to Kendra. And stars aligned, and here I am today. So I've been working with small and mid-sized businesses for the last 3.5 years, trying to help them navigate the people issues that are getting in the way of people enjoying work, but also getting in the way of profitability and greater success for everybody. So that's what I've gotten really passionate about doing. While I was at Turning the Corner, I knew that FAMLI was actually going to start to be put into place. And I have managed leaves in the past. I've managed a team of people who manage leave. And so I knew that this was going to be a big change for employers, particularly for small employers who've never had to manage leave in this way before because they're not large enough to have to deal with FMLA. So I'm going to spend some time talking about FAMLI today. Mostly I want to talk about practical solutions. How do you make this work for you, knowing that you kind of have to? But how do you find ways that make it work for employees, that make it work for the business, that help you reduce risk, and help you still get all of the work done? So that's what I'll focus on today. Because we're a small group, please feel free to stop me along the way, ask questions. I should have time at the end for Q&A as well. So with that, I will just go ahead and get started. So here's my agenda for you. We're going to start with an overview of what Colorado Paid Family Medical Leave is. So PFML, I might say that stands for Paid Family Medical Leave, or FAMLI, which is Family with an I, which is the official name of the program here in Colorado. So then I will get into best practices for how to administer PFML to reduce cost for you as an employer and also avoid risk, which is really important. I'll dig into some common issues that arise with leave, help you understand the job protections that exist and eligibility rules. And then we'll talk briefly about how you can, if you want to, utilize private plans and how to deal, if you are a multi-state employer, how to deal with some of the gaps that show up with that. And I'll touch on some tips for creating effective leave policies. So I know it sounds like a lot, but hopefully I'll be able to make it pretty accessible for you. All right, so here is the high-level introduction to FAMLI. You've probably heard a lot of this, but this was passed through a voter initiative. In other states, it was pushed through by the legislature, but in Colorado, this was actually a voter-led initiative. So the high-level overview is that it provides wage replacement for qualifying life events, like caring for your own medical condition, or frequently maternity, paternity leave, or caring for another family member, so like elder care for somebody who has a serious health condition. It provides you up to 12 weeks of leave per rolling calendar year. And as I said, it's partial wage replacement, so there's a sliding scale for that. It also provides job protection. We'll talk about that in a moment. And there are different options. So you can have continuous leave or what they call single segment, like I need to be out for 12 weeks or I need to be out for a month. That would be continuous leave or a single segment leave versus intermittent leave for somebody who has a serious health condition. Like I might need to be out 2 or 3 days a month, but I can't predict when that's going to be. Or a reduced work schedule. I need to reduce my time to only 50%. So these are the different types of leave you can have. It is funded through payroll taxes. It's 0.9%, and generally that is split between the employer and the employee. So we're all paying into this program, which is a very critical component to understand. And I'll talk about that in a moment. But there are some exceptions. You know, an employer could cover all of it if they wanted to, or for very smaller employers, it's just going through the employee. So this started paying benefits in January of 2024. So it is really still pretty new in the scheme of things, and actually people making use of the benefits about, you know, a little over a year and a half now. And many other states have similar programs. I'll talk about that in a moment.
Do we have any stats on how much we've paid out? How vigorously is this used?
Yes, I don't have those off the top of my head, but I would say in the first 6 months, it was actually being underutilized by 44%. They had expected much higher utilization, and and when I say they, I mean the state, what the state identified as one of the gaps is education to employees, particularly through small and mid-sized employers, which is when I read that, I went, oh, they're gonna start pushing education to smaller businesses, which means utilization will probably go up, which it has in the last year. I was just looking at the numbers, but I mean, it's many hundreds of millions have been paid out through this program, which is a good thing, ultimately, yeah. Okay, so here are some of the benefits for, and I'm gonna focus on employers. Here are some of the benefits for participating or using paid family and medical leave appropriately. So there are major savings for the employer if you consider it a return on your payroll taxes. So in the past, and actually I will still see employers do this, they'll have employees go out on PTO for a month or 6 weeks, and they're paying the full salary for their employee. And I'm like, hold on, stop everything. You don't have to do this. You can get your money back that you've been paying in your payroll taxes. Put them on the leave. That's the thing that you should be doing. And they're like, oh, I didn't realize. You have to reframe it as getting your money back that you are already paying into this program. And the same thing for employees. And that's what I've often done when I'm counseling employees directly, is to say, this is your money. You should participate in this program and go on this leave so you can get your money back. Another benefit of the program is that sometimes employees, when they go out on leave, they feel guilty about their coworkers, people who are covering for them. And so there is a tendency with some folks, particularly your high performers, to come back before they're ready. And that sometimes means they haven't fully recovered. There's risk of re-injury. There can be performance issues around that, additional stress that they don't need in their life. So all of those things, it gives them a little bit more of a cushion and time to come back when they actually are ready. Another benefit is a third party is actually reviewing these claims, the third party being the state, or if you have a private plan, the insurance company. And by that I mean, in the past, when you are just doing that yourself as an employer, your HR person, if you have them, is looking at medical documentation and trying to figure out if this is a legitimate claim, and maybe talking to another physician. It puts you in a difficult position of having to maybe deny or kind of doubt the validity of a claim. With the state doing this, somebody else is making that determination. So there is some benefit there. So in the big picture long run, this can save you money on replacing employees. Turnover is really costly. So in other scenarios, employees might just say, you know what, I'm just gonna quit. I have to be out, I've got this situation, I'm just gonna leave. And then you lose a great employee instead of sitting down with them and trying to figure out how you might be able to use this program and PTO and other things to figure it out and to keep a good person. And in the really big picture long run, that starts to build loyalty, right? Because you're demonstrating this supportive culture. And so that might really create a much longer relationship with this employee. And of course, because you do have to participate in a program, another benefit is avoiding risk for fines or litigation. So hey, that is still a benefit, right? Now, there are some challenges that I want to cover. Employees are entitled to this leave. And so in the past, when we might have just been generous with our employees or trying to make things work, we're in a different scenario here where we do really have to honor this entitlement with our employees. So it does reframe the conversation a little bit. And there's the reality of planning for and staffing for these absences. You have to really start thinking about your staffing strategy differently a little bit and assume that you will have employees go out on leave at some point. You can't staff so close to the red line that you can't tolerate somebody going out on leave. So that's a shift that particularly smaller employers have to start making.
Because John, there's no exemption for anybody. If you've got one employee, this applies.
Correct. Yeah. As long as, yes. So, yeah, it is something, it is a reality, right? And people can predict these things, and sometimes you just really can't predict it. It's life. It's life stuff that's going on. It's your own health. It's the health of your parents or family members that, you can't predict some of these things. So they will inevitably happen at some point. So I know I said that third-party approval of claims was a benefit, and it is, but it's also a challenge because it means that somebody else is looking at and approving this claim, and you might say, like, well, I don't think that's legitimate. You can ask for a reconsideration of claims from the state. You can appeal that if they don't find in your favor. So there are ways that you can deal with that. Another challenge is holding jobs open for employees, right? So that is, again, when I'm talking about staffing strategy, you need to be prepared for somebody to be out for a couple of months, and whether it's through cross-training or coverage or temp support or whatever it might be, coming up with a plan to handle that situation is going to be something you'll want to consider. And then the administrative overhead for tracking of leave. So depending on the size of your organization, if you've got like 30 or 40 employees, you've got a few people out on leave at any given time, there's paperwork, there's tracking, there's communication that has to happen. There is administrative overhead to this work. But there are risks in not doing all of that work properly. So there can be retaliation claims if you're taking an adverse action, so firing somebody, giving them a bad performance review, or just treating them poorly because they said they wanted to take leave or because they did take leave. It increases risks in those areas. You would have some risks if you deny or misclassify their leave, or if you just fail to mention that they're eligible for the leave in the first place, or you're not restoring them to the job that they had before they went out. So there's all these legal protections that FAMLI does provide. And you just really want to make sure also that you're keeping up with registering, making the payroll deductions, remitting. One of our clients that I was just talking to the other day, their payroll company, their third-party payroll company, just didn't do any of the family reports for a year. Just like dropped the ball completely. And so they were getting all of these horrible letters, and call up the provider who will remain nameless. But they said, what's going on? Why haven't you done this? And then they said, oh, this is going to take us about a month to resolve. And like, a month? Right? So you just got to make sure that all of these things are happening properly, because you might be subject to fines.
Is there a required poster for this, like the other thing?
Yes, there is.
So there's no excuse for not educating your employees.
There's no true excuse. Although, does a poster really do that? No. I don't think the posters, yes, you can post it up, but I do, and I'll talk about this later, I do really recommend really looking at your policies and then re-educating employees about how you're going to be approaching this as an employer. Oh, yes.
To the point of risks and retaliation, keeping roles open, what does it look like, and you may be getting into this so you can kick the can if you need to, what does it look like when you have someone who has taken up to that 12 weeks and is maybe still not able to come back? And now you're getting into that gray area of, nope, like super happy to keep this role open for you, but now we're up against a timeline here. Good employee, don't want to get rid of you. And also, I've gone now 3 months without someone and I need to fill this role. So.
Yes, I am going to kick the can because I will talk about that. And I actually just went through that scenario with a client. But yes, it does get tricky.
Okay, and then my question is, do they have to be restored to exactly the same job?
Not exactly the same job, but equivalent, yes. So we will talk about that.
Could I also add one more thing? What happens when it comes down to something like it would otherwise appear like job abandonment? Like lack of communication.
Oh, yeah, I'll talk about that a little bit too.
Thank you.
That does happen in leave scenarios sometimes. Yes. Yep. So first I want to talk about coordination of benefits, which is going to start to lead me into, actually here it is. It's on this slide. Okay, so coordination of benefits. Let me start first by saying FAMLI, along with short-term disability, that's what I mean by STD in this case, and FMLA, so that's the federal unpaid job protection. You have to have 50 or more employees in a 75-mile radius to be required to honor FMLA. But if that is true, all three of these things should run concurrently. And by that I mean like you are running all these at the same time. You're running, if you have short-term disability, you're running a claim along with FAMLI. If you are subject to FMLA, you're making the employee aware that FMLA is running at the same time as FAMLI. And the reason that you want to make sure that you're doing that is because it prevents the third bullet point here, stringing together leave entitlements. If you don't run them concurrently, then an employee can say, oh, I'm going to take FAMLI, and then, oh, well, then actually FMLA applies too, and so I'm going to string that along. Then you've got a much longer leave going on. So you just really want to make sure that you're appropriately utilizing all of those entitlements at the same time. But it doesn't change the benefit amount. It's not going to exceed their standard wages that they are entitled to. So it doesn't increase the amount they get. It just actually, for you as an employer, decreases their entitlement. So when you are in the situation that an employee is able to return, you have to start considering ADA, the Americans with Disabilities Act. And so if they are able to return, great, you have to return them to about the same job, like same pay, same level of responsibility. It doesn't have to be exactly the same, but it should be pretty much the same. But if there are restrictions that you will hear from their physician, then you have to consider light duty or alternate assignments. You have to start talking about, well, how long does this restriction last? Is it going to be, for a couple weeks, a couple months? And then you have to start considering whether that is going to create undue hardship, is the phrase, for the employer, in which case you don't have to do it, but that undue hardship threshold really means like it's going to cause damage to the business, right? So that is a separate obligation that you then have to consider. But if it does create undue hardship and they really can't do the essential functions of the job, that's when you would start to consider what the next step of support for them is. And so if you have short-term disability and it's been running concurrently, then they can transition onto long-term disability. And so you're not like dumping the employee out on the street. Instead, you're transitioning them to the next step in the benefits that you have.
What does that look like in the case of it's not the employee that is disabled, but rather they went out on leave because they became the caretaker for an elderly parent? So it's
Yeah.
not their own ability.
Right.
So ADA doesn't really come into play.
Does not, and neither does long-term disability.
Exactly.
So then you
And
would,
neither does short-term disability, really. They're not
Right.
coming out on any kind of disability.
right. So then you have to start considering, what type, like creatively, you're not under any obligation, but creatively, what can you create for this employee? What kind of flexibilities is flexible scheduling or job share or reduced, FTE or something like that going to help them be able to take care of this situation? Kind of depends on the type of job and so many different factors.
It's more open at the point that it is not the employee themselves
Yeah.
that was impacted.
Yeah, it's more open and in some ways more complicated because it's more open.
Right.
Yeah, so we can talk about specific scenarios if you want after. And then also just all of this goes out the window if it's a workers' comp claim, right? So if it happens on the job, then you have to start with workers' comp from the outset and begin your claim there, and everything else waits for a moment while workers' comp takes over. But overall, the best practice here is you gotta take a look at your internal leave policies and the processes to make sure that you are communicating and notifying employees properly about how these entitlements are working and running together.
For small number hourly, like someone working 10 hours a week, they're still, all of this still applies, but everything is calculated based on their average.
Yeah, there's a look back period and it's gonna be a pretty small benefit. Yeah. All right, so then we get into PTO. This is a whole other kind of kettle that you get into. So employers may allow the use of PTO to supplement the benefits, so paid time off. So meaning, as I said before, it's a sliding scale, right? So employees might get anywhere from like 50 to 90% of their wages. It's usually around 60. So that leaves a chunk, right? And if you want, you can fill that in and provide the option for using PTO to supplement, basically make them whole. But you don't have to. And also, for those folks who have any sort of unlimited PTO plan as part of their package, this gets really complicated. All of a sudden, they've got a fully funded 12-week leave if you don't put any limits around it. So one thing you might consider is saying, well, when somebody is out on leave, we will supplement for this period of time, 6 weeks, 8 weeks, with, they can use their PTO to supplement. So these are the things you have to start considering. Assuming that somebody is going to go out on leave, how might my PTO plan interact with this? Regardless, the total combined benefit's not going to exceed your normal wages. Again, it's not like people can make more when they're out on leave. And my advice on this is look at your policies and make sure that you are instructing employees or creating an expectation that any health-related absences or care for a family member or anything that would qualify for family or another type of entitlement should be examined for eligibility, whether it's by the supervisor, by HR, whomever it is. Say like, Sally's been out for 4 days now. Like, is this a serious health condition? Should we be supporting this differently? You just really have to look at all of your PTO policies differently now that you know that family is in play. It just really changes the field. And I've had a couple employers get caught by this unlimited PTO thing, where employees might say, but I've got unlimited PTO, I don't want to go on family. I'm just going to be on PTO, that's easier. Like, okay, but then you're not getting any of the savings. And the employer's not getting their tax money back, the employee's not getting their tax money back. So it's taken some work in those situations to kind of redirect the employee into family. And that's when I say to the employer, like, we need to change this policy. Like, you got to figure out something else. So, Liz.
When I first started at Turning the Corner, that's the first company I ever worked at that had unlimited PTO, and I was wondering how that all worked. But when they gave me the handbook, there was a lot of details about things like this in it. So I was like, oh, okay, yeah, that's super understandable. Because I was thinking too, like, unlimited PTO, does that mean like you're encouraged to use it or you're discouraged to use it? Like, there's a lot of things online that I read about it that, you know, if you have your policies like really dialed in, I feel like it can be a good thing.
Yeah. And I think you're right. And the unlimited PTO thing has had its ebbs and flows over the last, I don't know, 5 to 7 years in particular. So I can debate that whole subject another time because I've got lots of opinions about that. Lots of pros and cons. All right, so let's talk job protection. So there is job protection under FAMLI if they've worked for at least 180 calendar days, and they must be restored to the same or equivalent job. And there's also then job protection to consider under FMLA. But as I said before, you've got to have 50 employees or more within a 75-mile radius. And then there are other qualifying factors for FMLA for the employee. And then you have to consider ADA as well. So there are all these things that are overlapping around the job protection. So it does become pretty complicated if you are in a situation where the employee, for whatever reason, can't return to the same job. There are several different things that you need to consider. So the best practice here is assume that they're going to come back, hold the job, but have a plan B. Like, you never know what's going to happen. You know, with any kind of leave, even, you know, I'll tell my folks, my clients, they have somebody go out on maternity leave and they said, oh, yeah, well, she's coming back. I'm like, okay, well, she might, or she might not. Like, she might change her mind, and that's fine. Or they say, oh, she's not going to come back. I'm like, oh, or she might. You know, like, people change their mind all the time with that situation. Or people say, like, oh, you know, it's a pretty standard surgery and they're going to be back and ready to work in a couple weeks. I'm like, or not. Like, that's the ideal, sure, but there are complications all the time with surgeries and other things, and people aren't able to. So I always say, have a plan B, have a plan C, because the unexpected is always going to happen with people. That's just life, and particularly with leave. There are always going to be changes. So the entitlement itself, re-eligibility. So like I said before, they're entitled to the 12 weeks per benefit year. That eligibility resets after that benefit year ends. So like I said, it's a rolling calendar year. So if they have a new qualifying event, they can reapply. So, and then in some scenarios, it might be that they would take multiple leaves in a year. So let me give you some examples. As an employee takes paternity leave on February 11th, 2025, full 12 weeks. That person is not eligible again for any other family leave until until February 11th, 2026. That's what that should say, 2026. But another scenario, if an employee took 6 weeks for surgery in January, they would still be eligible to take another 6 weeks later in the year if something else happened, another reason, another surgery, their own condition, a family member. So all this to say, it could look and feel different for different scenarios. I will mention that there is that private plan exemption that people can opt for as long as the benefits are equal or greater. So you can opt to get a paid family leave plan through your usually through your short and long-term disability carrier. They'll bundle them together. You can get some savings out of it, actually. In practice, I don't see a lot of benefit. Some of the private insurers have not been ready, and they don't have like an online portal set up for this particular leave. They're doing forms, so that is suboptimal. And I'm actually surprised and proud to say that the state has done a pretty good job with their online portal. And their customer service for my clients has been actually pretty good when problems arise. So I did not anticipate that, but I'm happy to say that that's the case. And so here's the pros and cons. So you might get some competitive rates from a private carrier based on your demographics, but it is based on your demographics, so you might not, depending on who you have in your pool. So the other thing is coordinating short-term disability with the state might get a little bit tricky, like you're trying to file these claims in different places. So again, just maybe more administrative overhead. And then if there are issues that arise with the state, their customer service is good, but you don't have as many levers to pull. By that I mean, like, they're not the carrier that's working for you, that you're paying directly. The state's gonna be like, well, no, this is the deal. Like, sorry, we've made our decision. So those are kind of the high level things that I would say. But I honestly, the service from the state has been pretty good. So I'm not necessarily a proponent of going the private plan route, particularly because you have to keep submitting annual attestations and renewals and all this. There's additional paperwork, so you're not even saving on the administrative side. You still have to send a bunch of stuff into the state. All right, multiple states. So this is where it gets really complicated. So I have several clients that have employees in multiple states. So they've got their Colorado people, and then they've got some folks in Georgia, and then they've got somebody in DC. And so you've got these states with similar programs: California, Washington, Oregon, New Jersey, et cetera. So then you have to determine what the primary work location is and follow whatever that state's law is, which gets you into an equity problem. If Colorado is giving people 12 weeks, but Georgia is giving people nothing, which is currently the case, how do I make sure that my employees have the same experience when they're in different states? I don't want the person in Georgia to not be able to, take time off in the same way. So I have to figure out, how am I going to make use of short-term disability? That will work for most scenarios, but not all if they're caring for a family member. So then there's an edge case where it doesn't fall under short-term disability. They don't have a state plan, but I want to make sure I'm providing the same benefit. How am I going to do that?
But you're not required.
You're not required. You're not required. But yeah, it's like encourages you, like, everyone should move to Colorado. Right. So you can have a different experience state by state. That's fine. But you start to get into that. What is our overall culture? Do we want to make sure that everybody is treated the same? And I think it's a best practice. And of course, the programs are different in each state. They are similar. They have all kind of based off of each other. When Colorado was putting our program together, we were looking at Washington and a couple of other states and using that as a benchmark. So they are similar, but not exactly the same. So it's just something that you have to consider and prepare for, again, in your policies and in your procedures of how you're going to deal with that. Because inevitably that will arise eventually. I do have some just common questions. When does that 12 weeks start? It starts from the date of the approved leave, not from the date of filing. So the approval usually happens fairly quickly, but there is some lead time there. You don't have to make employees whole on pay. No, but you can supplement with PTO or other benefits, like I've mentioned. Oh, the medical, dental, life insurance, all of those insurances must continue. They have to be maintained as if the employee is actively working. And just a practical note on this one, this is where supplementing with PTO can be very helpful because the premiums, if you're not paying them, if they're just getting paid from the state, then these premiums either stack up in arrears in your systems and then they come back and they have to pay all these medical premiums, or they're like writing you a check, or you have to come up with some other mechanism for them to pay the premium. They're part of the premium cost. So when you allow them to top off and use PTO, it can just come right out of your payroll. So yeah, and then sometimes you'll be in a scenario, particularly with your hourly employees, where they have applied for the leave, it hasn't been approved yet, they can't work, and then you're just waiting. And the question that I run into is from clients is, well, should I pay them? I mean, I think they're going to get approved, but I don't know. We're going to supplement, should we just pay them that? And it's tricky, you just have to make a choice. There is a little bit of risk involved here. So you have a risk of overpaying them, and then having to get that back over subsequent pay periods, or underpaying them, and then they don't have any money and they're stressed out and they're waiting for this payment from the state. So it is tricky. So here are the best practices that I've got for you. Here are kind of my recommendations for the major points you want to hit in your policies. Particularly this review of health-related absences over 3 business days, similar to the FMLA guidelines around that. So that's what I just recommend taking a look at. And it doesn't have to be formal, super formal, but do you have the flu, or is this a serious health condition that is going to be maybe longer? And then that's the kind of review I'm talking about. Make sure your eligibility criteria are very clear, as well as the required documentation, making sure that that's clear for people, what they're going to have to produce, how you're coordinating with all of these different programs, FMLA, ADA, STD, PTO, all of these different things. Get really clear about how it coordinates with that, and the job protection provisions. And then in particular, the PTO supplement, whether or not you're going to do that, how employees request it. You want to have it in writing that they have requested that. So all of that needs to be really clear in your policies. This is not something you want to be inventing on the spot when somebody is going out on leave. And so these up-to-date internal procedures, yes, the policy for the employee side, but you have to know what the heck you're doing, and how you're going to be following up. And there is that administrative work that goes into leave management. That's just the nature of the beast. So have some checklists. Do yourself a favor, have some template emails that you are always going to send to your leave participants with all of the information that they need, with the links, with their obligations, because they need to communicate while they're on leave. They can't just completely check out. You're not supposed to talk to them about anything work-related, but you can talk to them about their leave. And if you need additional paperwork, or if you're wondering when they're coming back, or what their restrictions might be, they have to respond. And for that, I recommend going old school and using the phone. So yes, send an email and then follow up with a phone call. Can't tell you how many times, the emails will go unanswered, because a lot of times people are dealing in the most stressful moment of their lives. So you have to make sure that you're getting through and getting the information that you need. So I recommend multiple methods. And particularly, I also like using the phone because you can communicate that you care about the person, that you're trying to support them, that you're having this more friendly and caring interaction, and that you're wanting to be flexible. It goes a long way of making the whole experience better for everybody. So, hot tip, use the phone. Not everybody loves it, but it really does have better outcomes in the long run. So when you get into the situation where somebody is not communicating, and not getting back to you, you're gonna want to let the leave run out, though. Like you can't like consider it job abandonment until they don't return from leave and they don't respond to you. Like, where the heck are you? Yeah, you got to give them their full entitlement if it's been approved. Yeah, whatever the end period of the approved leave is. Yeah, and then if they're not responding and they're not showing up, then you could go the job abandonment route.
So like at that, if it started on September 24th, you have until December 24th, which is the 12 weeks, right? Or call it about that.
Okay,
Yeah.
sure.
Then it would be whatever the Colorado abandonment policy is for jobs would kick in on the
Generally
12th.
around 3 days.
Yeah, 3 days. Yeah. Okay, cool.
Yeah.
If I'm a company of one, can I use this?
So if you are like a sole proprietor or self-employed, you have to apply, you have to go and actively sign up and start paying into the program. And so if you know you will have a need for leave in the coming year, then you could proactively do that. That's a good question.
I believe that FMLA included coverage for military leave. Is family the same or no?
Yes, military exigency, I think is what it's called. Yes.
Okay. And then what about bereavement and like settling estates of family members that
Right.
adjacent?
No, not so much. But there is Colorado's Healthy Families and Workplaces Act, HFWA, that requires at least 48 hours of sick time that rolls over, and bereavement is included under that. Yeah.
Oh, 2 days, hey.
Yeah. 2 days.
Yeah. Oh,
Well, what is it? 6 times 8, 40? Yeah. Well, it's six days so 48 hours.
Oh, 48 work hours.
48
work
work hours.
hours.
oh.
Sorry. I'm always thinking about like banks of time rather than, so 48 work hours. Thank you, Liz.
Way more sense.
Yeah.
I was thinking too, like, dang, get over it.
It's been 2 days.
Yeah, and then you can have additional bereavement time in your policies if you wanted to, but I advise, the utilization of that sick time first. Yes.
Back to family, what does payment look like for employees? Is that coming directly from the state? Is it paid out weekly, bi-weekly?
So it's paid directly by the state or by the private insurer. So the state pays it weekly. The private insurer might do it a little bit differently, but particularly if it's taken some time for the leave to get approved, they might pay like 3 weeks back, right? If it took a little bit of time or you filed after the fact, which sometimes happens, like something critical happens and then you don't file until a couple weeks later. It's retroactive, and then they'll pay those back weeks, but they pay weekly. And so a check or ACH, direct deposit.
Does that get reported to the employer?
How much? So this is such a pet peeve of mine. The exact amount does not get reported to the employer, which drives me crazy. You get automatic notifications like that the leave has been filed, the leave has been approved, and then the employee gets a letter that says, and this is the amount that you've been awarded, or this is your benefit amount. And so the employer has to go and chase after the employee to get that dollar amount. I don't exactly know why they've done it that way. It does bother me, but this all gets back into the communication piece. And I've actually put that into policies before around the expectations for employees on leave. That like not only do you respond, but you need to provide us with any documentation requested, that has been provided to you by the state. Yeah, I sang the state's praises for the system itself, but that part of it, not so great. A critical mass. Oh, I agree. So like I've said, review those leave policies, communicate the rights and responsibilities to your employees, and then you've really got to track this leave usage and manage the coordination with other benefits. And then it's only, like I said, it's only a year and a half that it's been paying. There will be changes, count on it, in how exactly it's administered. And there will be changes to the benefit amounts over time and things like that. So you're just going to want to pay attention to all of those different factors. And of course, Liz would kill me if I didn't say that we can help you at Turning the Corner. We can help you with all of these things. All right, so those are the main things. Any other questions?
I did have a couple that were emailed in, if nobody else
Go for it.
has one. Okay. Let's see. One person asked, what if my employee wants to use PTO instead? Can I make them take FAMLI?
Yes. So no, actually, good question, but no. But this is why you want to have your policies written in a way that says PTO should be used for these kinds of things, but if it is a medical situation of yourself or care for a family member or any of these other reasons, we should be looking at these other entitlements. And so you're setting up that expectation, and then you can just really strongly encourage the employee to go the family route. And there are some compelling reasons. And the one that I always start with is, this is your money that you have been paying through your payroll taxes into this program. Don't you want to get it back? And then also, it's not a motivator for all employees, but I will also say, and it really helps out the company, because that means that we can support your leave for as long as you need, for as long as you're entitled to, because it's reducing the hit on our budget. And so then they go, oh, okay, like, it's good for me, it's good for them. Like, okay, I'll go this route, I'll do the paperwork. And so you just kind of keep nudging, kind of water on limestone approach, just kind of wear it down a little bit, and then direct them to the appropriate route. So there's a little foundational stuff you want to make sure you've got in place, and then it's all in the conversation. That's why I'm always saying, like, face-to-face conversations, phone conversations about the need for leave will always set you up for success in the long run.
Another question is, should my employee exhaust their PTO first before using FAMLI?
Ooh, yeah. No, it is different. And this is something that I see, so it's a great question. So no, they shouldn't. One, you can't require that they do so, but also you don't want to do that. You want to get them on the leave as soon as possible, because you want to start to utilize the benefit and to start chipping away at that entitlement of that 12 weeks. If you run out their PTO first, if you allow them to take weeks of PTO first and then put them on leave, then they have an additional 12 weeks. And so then you're out for this much longer period. You don't have your employee for a much longer period of time. Additionally, on the employee side, it's not actually a great experience if you run out your PTO and then you come back from leave and you don't have any time. Because if you've got a wedding or even a short vacation or something, right? Like the joy part of life is suddenly diminished. You don't have the time to take. So the best thing to do for everybody is to start the leave as soon as possible. Supplement the PTO if that's their choice and part of the way you want to set it up. Utilize that supplement, but that way the entitlement is starting when it should appropriately. You're running out the entitlement, and then they'll have PTO afterwards if they need more time, or they return and want to take a vacation sometime in the latter part of the year.
Other benefits continue during the period. Does PTO accrual have to also continue?
No, it doesn't. Yeah.
But it could if the employer wanted to.
If you wanted to, yeah.
That would be a thing to be specific about.
It would, yes, yeah. Yeah, it does. That part doesn't have to, I think, and because, so the Healthy Families and Workplaces Act that I mentioned, the way that it's often set up, not always, but like the minimum requirement is 1 hour of that sick time per 30 hours worked. So they're not working when they're on leave, so then you're not, if you have it set up that way, you're not accruing that time. If you have another type of sick policy, then it might, but yeah, that's something you'd want to consider as well. Got to look at all of these policies. They all, that's a perfect example, yes, they all interact like that, yeah, in a tangled web.
In 2000, I had my first child, and I knew I was having a C-section, and I read the employee handbook, and they gave 12 weeks of medical leave, and because I was having major surgery, so I'm gonna take my 12 weeks. And those men were so pissed off at me, but they went to the attorney, and they went to the state, and the state's like, oh no, you have it right here. She gets her 12 weeks. She's having major surgery. Oh, yeah.
Well, and
How did, well, back then, they didn't give you any type of, I had a coworker that had a baby and had to come back in 2 weeks.
Yeah, I worked at a company that had no leave of any kind for maternity, none. Women were forced to take PTO and PTO only. And if you were hourly, you got max 2 weeks of PTO. And to your point, if you had used any of it for like a long weekend, a wedding, whatever you had in your PTO bank was what you could use.
yeah, and I mean,
My kids too.
that's when you start thinking about the bigger picture. Yeah, yes, there are some headaches for employers, but the bigger picture of what this is intended to do is to create a standard support system for employees who have a legitimate need for leave, whether it's for maternity or caring for a family member or other illness or accident or whatever it might be. That there are a lot of folks, particularly lower wage earners, for whom that can be a catastrophic event that really sends their life in a different direction. And this can help, keep them employed. And like that's ultimately what we want, is for people to be able to take the time they need, but then come back and be a productive member of your workforce and be healthy and happy and engaged. So yeah, so I will also say on the flip side, because I know everybody thinks about this, there will always be leave abusers out there. That is just a natural part of the world and life, and those happen, but they are a smaller edge case. So you can't let that color your perception. So sometimes when you're working with your employees or your leaders and they're like, oh, why is this person going out? I'm like, but this person really needs our support right now. And they're going to come back. They're a good employee. And 9 times out of 10, or even more than that, 99 times out of 100, that's what's happening.
I appreciate your insights on how it was underutilized in the first 6 months, wherever it's landed at this point, who knows? But I've asked the questions that I've asked because we do have an employee who has gone out on leave specifically because his father had a very severe heart attack, almost died earlier this year. Has COPD, has all kinds of other complications. And he was really trying to come into work, but he was breaking down at work. And my parents, who are the owners of the company, finally said, you need to take leave. Like you're not able to work. Go take leave, go take care of him, go take care of your family, go take care of yourself. We will be here when you come back. And it's been hard for him to communicate consistently, and we're coming up on that 12-week period, but it's, we'll be surprised if his dad makes it by the end of the year.
Yeah.
And it's just hard, but it's a reality of he had no idea. Some political beliefs got in the way of what the family policy actually meant and what it could be used for. And he's been really grateful since being re-educated to the point of where it started this of, oh, I paid into this. You guys paid into this. It's here for this reason. Thank God I don't have to drive all the way from Franktown.
An initial reluctance to make use of the benefit, usually or often on the employee's side, they either don't understand it or they don't want the situation they're in to be real and that it's truly getting in the way of them working. And so they're gonna try to come in, they're gonna try to make it work, and then it really doesn't. And unfortunately, what sometimes happens, particularly when it's their own health condition that's getting in the way, is that performance issues start to come up a lot. And if it goes for too long, then the frustration on the employer's part starts to increase, so that by the time they go out on leave, the employer is already frustrated with this employee. And that starts to color the leave itself and to lead to maybe a suboptimal experience there. And so instead, if you're getting in front of it, if you're starting to see these things, and what this all gets back to is better relationships between managers and employees, and for them to care enough to say, hey, I've noticed X, like you're struggling to come in on time, or you seem distracted, or you seem really stressed out. Is there anything that we can do to support you? What's going on? How can we help? Right? To have that initial conversation, to find out if there's something getting in the way, and then immediately kind of putting that forward to the right channels, whether it's HR or whomever is managing this for you, so that they can start to really understand how a company can support them, so they can take that time before the performance starts to really become a problem. The employer gets to make a plan and to get the coverage in place. The employee gets to take the time that they need, and it doesn't impact them negatively. You know, so it's just a better case scenario all around if you can get in front of it and, you know, start that education and have them take the time. So yeah, I've seen it happen a lot, and like I said, particularly when it's their own condition, that it might be something that's limiting their function and limiting their ability to do their job. That one's really hard. I had a case where an employee had macular degeneration, and so her field of vision just kept getting smaller. And and we made accommodations through the ADA, but at a certain point, we had to say, you just can't do this job anymore. We're so sorry, you know, and we just had to try to find something else, but there really wasn't very much we could do. But in those kinds of situations, people don't want to admit that it's happening.
I had one with a malignant brain tumor, and the thing that she wanted most in the whole world to cope with this situation was to come in and have a normal day.
Yeah.
But migraines, 80% of days, and not completing tasks, and like there's competing. What does caring look like here? Because
Right.
some of the leadership was like, I am not terminating this person with a brain tumor. Like it's not in my humanity to do that.
Right.
But then they're also like the finance manager not providing accurate financial reports for 3 months. And so like that's such a tricky human situation.
Yeah, and so that's when you really want to get somebody involved who can help figure out what can we do. So if you can't, so we know that we need all of these things done, but you have so much knowledge and expertise. Maybe we can put somebody else in place to do the day-to-day, and then we can tap you, this very experienced employee, to advise and mentor them and grow them. And so not only then are you giving a sense of purpose to the employee, but reducing their work schedule to maybe make it more manageable, but also this other employee is getting mentored and led, and there's a succession plan and some professional development. And so then you can find maybe a best of both worlds in those kinds of situations. But you're right, often employees do want to work because it's the sense of normalcy that they're craving. Yeah, it's a lot of communication, a lot of difficult conversations sometimes, but that's the nuance and the gray that a lot of HR professionals live in. So that's what we're here to do. Well, thanks so much for your time and your questions. And